Hello, everyone. Today, we'll be discussing this research that was conducted by Yokley and Glenwick. Now, this particular research was conducted in the year 1984, and we come across this research while we're preparing ourselves for the second unit from health psychology, that is, adherence to medical advices. Now, before we even begin, I'd like to remind you all that this particular study is a key study. We refer to this study as a key study, and when I use the word key study over here, what I mean is we are expected to know bits and all the detail that are there for this particular study, because in our examinations we can expect the examiner to ask us anything, like literally anything from this particular study. So taking this ahead, having a look at the title of the study, if we give the title of the study a read, it says increasing the immunization of preschool children. Let's read that again. Increasing the immunization of preschool children and evaluation of applied community interventions. Now, we're talking about the different mechanisms, the different ways, the different ways or the mechanisms that are used by the government, by the state, by the health and the medical care departments to ensure that there is more of adherence towards medical care, and additionally to be promoting health as well. So how is it that immunization amongst children or vaccinations that need to be administered to children, they're done so in a regular manner? And how is it, or to what extent is it true that if there are different strategies used by the government or by the state, by the medical health department, if they offer any sort of an incentive to the parent, would that actually work? So, increasing the immunization or vaccinations of preschool children and evaluation of applied community interventions. Now, as we speak about community interventions over here, and we have a look at the context of this particular study, we see that we should know that back in the 1970s and the 1980s, there were there were a range of different strategies that were used by the US government to tackle certain socially significant community problems. Now, this, of course, is a socially very significant community problem, because if preschool children, they're not vaccinated when they should be vaccinated, and if the parents, they do not show a disciplined attitude towards these vaccinations or immunizations, this can consequently lead to increasing the chance of that particular child falling sick as they grow older. Not only that, but there have been certain laws passed, there have been certain policies that put a ban on these sort of students. So the students or the children who are not immunized or who haven't had their vaccinations done, in many parts of the United States, they are not allowed to attend school. So that is a problem. So what I was saying is, back in the 1970s and 1980s, there were different strategies that were used by the US government to tackle certain socially significant community problems. Now, what socially significant community problems am I talking about? Like reducing pollution, conserving energy, taking care of oral hygiene, that is dental care, along with that, emphasizing on good nutrition, catering to the safety concerns of the citizens by ensuring that the citizens, or ensuring that people within that particular community are wearing seat belts, so on and so forth. So up to this point, these attempts had not been applied to immunization, although figures in the lead up to this study have shown that uptake of childhood immunizations can be very low in some areas. And the areas where the immunization of children is low, we refer to those areas as immunization deficient areas, right? So immunization deficient, what does the word immunization deficient over here mean? Those areas have children who haven't yet had their vaccinations as yet. So these can have serious repercussions, not only because children are left vulnerable to serious childhood illnesses, but also some children's education would suffer, as some schools ban children who were not fully immunized. So taking this ahead, now that we're done with the context of the study, we could move on and talk about the main theories and explanation. Now, if we speak about main theories and explanation, the first thing that I'd expect you all to be familiar with is community intervention. As I use the word community intervention, what does the word community intervention over here mean? Any sort of attempt to encourage a certain behavior in a town or city using methods such as leafletting, letters, or even lottery. So, community intervention, the name community, the word community intervention is pretty self explanatory in itself. So, having a look at the main theories and explanations, there are two researches that I'd want you all to keep in mind as the background researches for this particular study that was conducted by Yokley and Glenwick. As we speak about these background studies over here, the first study was conducted by Byrne et al. In the year 1970, and this is another study that was conducted by White in the year 1976. So there are two researches that I'm expecting you to remember, along with this study, which is, of course, the study that we're primarily focusing on right now. That is the study that was conducted by Yokley and Glenwick in the year 1984. So the two background studies that I just named are the study that was conducted by Byrne et al. And the study that was conducted by White in the year 1976. So if we have a look at the main theories and the explanations for this particular research has shown that community interventions such as multiple prompts and lotteries can have a positive effect on the number of children being immunized against potentially fatal childhood illnesses. So there have been certain researches that have shown us that certain strategies that of course come under the heading of community intervention, such as using multiple prompts, such as offering incentives such as lotteries, or offering the parents or offering the family a free vacation, they can have a positive impact on the number of children being immunized against potentially fatal childhood illnesses. So, if we talk about the study that was conducted by Byrne et al. In the year 1976, Byrne et al. Measured the effects of multiple prompts, measuring the effects of multiple prompts to encourage immunization. We're talking about prompting, we're talking about reminding parents, right? Reminding parents to get their children immunized. If we talk about this particular study that was conducted by Byrne et al. In the year 1970, he sent out a computer-generated motivational prompt to half of parents with 2-month-old babies. So understand this first. We're talking about a particular community. We're talking about a study being conducted in the Rhode Island. We're talking about half of the parents with 2-month-old babies being sent a computer generated motivational prompt, right? A computer generated motivational prompt. That is step one. If there was no response after 30 days, a second more emotional prompt was sent, right? Step two. And if there was still no response, a telephone or house call was made. So we're talking about three different steps. This background study that was conducted by Byrne et al. In the year 1970, what he did was he sent computer generated motivational prompts to half of the parents whose children were 2 months old. If the computer generated prompt did not work, he ended up sending another more emotional prompt after 30 days, after waiting for 30 days. And if that did not work either, he got a phone call made, right, to those parents. And of course, this is why we're referring to this study as an attempt where there are multiple prompts being sent to parents, right? Now, if we have a look at the results of the study, we see that parents from the upper class, for parents from the upper class, there was 10% improvement, which is not bad. And so was the case for parents from the lower class. However, if you talk about parents from the middle class, these multiple prompts, they only affected or they benefited 5%. There was only 5% improvement that was witnessed, right? So having a look at this, results showed that for lower and upper classes, there was a significant 10% increase in immunizations compared to those who received no prompts, and a 5% that is non-significant increase for middle class parents. Now, it worked better for the upper class and the lower class parents. Having said that, if we move on towards another study that was conducted by White in the year 1976. Now, what White did was, White conducted an informal field study where there were radio DJs who played an important role by encouraging parents to get their school age children immunized. So we're talking about how radio DJs during their shows, they encourage parents to get their school age children immunized. Now, I'll tell you what the catch is over here. Prizes were offered, including a lottery for a week's holiday in the Bahamas. Now, there were different prizes that were offered, and there was amongst these prizes was a lottery that offered a week's holiday in the Bahamas. And you know what? This actually worked out really well. Now, if you have a look at the results here, where every signed immunization permission slip was added to the draw and one was drawn at random. So everyone who gets the child immunized, they just uh, put up this slip, let's just say in a box. And in the end, there was a random draw. And through this draw, as a parent, you could win a week's holiday in the Bahamas. And you know what? This actually led to a significant amount of improvement, because this led to 92.6% of permission slips being returned. So what we get from this is positive reinforcement. Remember, positive reinforcement, operant conditioning, when you're reinforcing a particular behavior, right? So let's connect this with what was taught to us back in the AS. So we could say that positive reinforcements or incentives do have quite a role to play in terms of helping individuals uh, improve their adherence rate. Now, taking this ahead, if you have a look at the aim of the study. Now, let me explain this entire thing to you. So what happened was, parents were sent in this particular study that was conducted by Yokley and Glenwick in the year 1984. Parents were divided into, let's just say, 6 categories, right? We're talking about parents whose children were not immunized, right? Who required an immunization. So we're dividing the parents over here into 6 categories, right? The first 4 categories, let's refer to them as uh, the experimental group, right? And the last 2 categories, that is the fifth and the sixth category, let's refer to that as the control group, right? So what 6 groups are we talking about here? Now, if you have a look at this part of the screen, you note that the first option uses the term general prompt, right? Compare this first one with the second one, with the third one, and with the fourth one. They say specific prompt, specific prompt, specific prompt. Now, what is a general prompt? How is a general prompt different from a specific prompt? And how are the 3 different specific prompts different from each other, right? To begin with, as we speak about the general prompt, right? The people who, or the parents who fell into this particular category, there were 195. They received a message, and the message said, "Dear parent, unless your doctor decided differently, your child needs X doses of X vaccines at X ages. If your child is behind any of them," and then you write down the inoculations there, "I urge you to make an appointment and get your child caught up." Now, this is a very generic prompt that you're sending to parents. And there were 195 parents who were sent this prompt. Moving on to the second one, that is a specific prompt. Now, for this specific prompt, there were 190 parents who were sent this one. They received a more personalized message containing details of the exact immunizations that the child needed. An example of this could be, to the parent of child's name, to the parent of dash, you put up the child's name there. Our records show that it is time for your child's name to receive the following shots. And then you put up the specific list that the child requires immunization for. Shots may be obtained free of charge then you mentioned the specific location of the clinic, the dates, and the time. Now, see, why is it that we're referring to this as a specific prompt? We're referring to this as a specific prompt because your child's name is written there. The exact medicines or immunizations, that the child requires are specifically mentioned there. Now, the third group, which is again a group which we refer to as the increased access group, where there was again a specific prompt that was sent. There were 185 parents who were sent this prompt, and they received the specific prompt as well as a second page that opened with the statement, "Attention, for your convenience, 2 special off-hours clinics are being held at the clinic's name and the clinic's address. So then there was an announcement of the additional clinic hours, such as Wednesday from 5 p.m. to 10 p.m. and Saturday from 9 a.m. to 5 p.m. with childcare facilities. Now, come on, all of this does cost the state money. So with childcare facilities that included food and entertainment. Now look at the amount of incentives that are being offered. The message ended with the statement that said, just sign all your children and you may go out for the evening or day while we take care of them free of charge. Hope to see you there. So the first category, we refer to that as the general prompt. The second category, we refer to that as a specific prompt. The third category, whom we're referring to as the increased access group. But over here, in this third category, in this third IV, uh, in this third, what do you call it? Experimental group. In this third experimental group, there was again a specific prompt that was used. Now, moving on to the fourth one, the monetary incentive group. Now, what exactly is this monetary incentive group? There were 183 parents who were sent this one. They received the specific prompt plus a second page that opened with the statement. So the second group, the third group, and the fourth group, they're all receiving specific prompts. Just know that. Attention, in our effort to get parents to have their children immunized against childhood diseases, the Akron Health Department, with support from PF Goodrich, is giving away $175 in cash prize to parents who turn in the tickets attached to this page. So we're talking about money being offered. $175. $175 is what we're talking about. The first prize being $100, the second prize being $50, and the third prize being $25. So this collectively makes $100, right? I hope you've understood how these prompts work. Getting back to the study, if you have a look at the aim of the study was to evaluate the effectiveness of 4 different conditions for motivating parents of preschool children to get their children immunized. These conditions were: number 1, a mailed general group; number 2, a mailed specific group; number 3, a mailed specific prompt and expanded clinic hours to increase access and convenience. And the fourth one, a mailed specific prompt and a monetary incentive in the form of cash lottery. Like I told you, the budget was $175, the first prize being $100, the second one being $50, and the third one being $25. Now, having a look at the hypotheses over here, or the predictions. Now, it was expected that, or the researchers hypothesized that the greatest impact would be from the specific prompt with the monetary incentive. So for the researchers, what they expected was that this would be the best of response amongst all 4, right? So it was expected that the greatest impact would be the specific prompt with the monetary incentive, followed by the specific prompt and increased access. This is the second best, let's just say. Then the specific prompt alone, 2 smiley faces here, and last the general prompt. So you see how this works in a descending order, right? So taking this ahead, having a look at the design of the study, the study was carried out on the entire population of an immunization deficient preschool clients. Children aged 5 and under at a public health clinic in an American city. A public health clinic, American city. Children were aged either 5 or they were under 5 years of age, right? So an entire population of an immunization deficient preschool children were catered to here. Now, how many were there in total? If you have a look at the numbers, out of 2,101 preschoolers, 1,133, that makes it 53.9%, were found to be in need of at least one immunization. Look at how important adherence to medical advices are. So more than half, that is 53.9% of the kids in that particular immunization deficient area were at least one immunization behind, at least, right? So there was an even number of boys and girls. 64% of them were Caucasians, and the mean number of immunizations needed was 5.2. So on an average, each child was more than 5 shots behind. That's bad. That's super bad. Let's quickly read through the prompts over here, which we've already discussed in detail. The families in the general prompt groups were mailed a prompt with general immunization information, urging parents to get their children immunization up to date, but without any specific or personal information. Number two, families in the specific prompt group were mailed a prompt that named the target child as well as the specific immunizations they required and giving the clinic's location and hours. Those in the increased access group, that is the third group, they received the specific prompt as well as information about extra out of hour sessions at the clinic, where childcare facilities were present and parents were told they could leave their children at the free childcare for the full session if they wished. Now, this is exactly what is being talked about over here. This is something that we've discussed already in detail. Getting back to what the book has to say, the monetary incentive, that is the fourth group, they received the specific prompt as well as information about a cash lottery that offered three cash prizes: $100, $50, and $25, requiring a ticket to be handed in when the child was taken for the immunization. Now, remember, I had a couple of minutes ago, I told you how there were 6 categories in total. The first 4 we refer to as the experimental groups, and the next 2 we refer to them as the control groups. So these 4 different groups, they were mailed, right? They were mailed. The first one was mailed a general prompt. The next 3 were mailed specific prompts, right? Now, which differ from each other, of course. There were 2 control conditions. Number 1, the contact control group, and number 2, the no contact control group. Understand the, take cues from here. There were 2 control groups. The first one was a contact control group, where the parents were contacted over telephone. These parents were not mailed, right? So when on telephone, or during the telephone call, the parents were requested to provide some information about their child's immunization, as well as there might be some questions that demanded or that collected demographic details on those parents and children both. But there were no prompts that were given, right? So we're talking about the contact control group. This contact control group, parents were telephoned, they were called, they were not sent a mail. The parents were asked about the immunizations that the child had received. There was information collected about the demographic details on these parents, and that's it. Bear this thing in mind, there was no prompt given. The sixth group now, that is the no contact control group. This group was not contacted at all during the study, right? So we've understood that there were 6 different categories. The first 4 being the experimental group, the next 2 being the control group, right? Now, these were the IVs, the independent variables. Now, what were the dependent variables over here, or what is it that the experiments were actually looking for? There were 3 main things that the experimenters were looking for. Number 1, the number of target children receiving 1 or more immunization. So how many children are actually there who do receive 1 or more immunization as a result of these mailed prompts that were sent to them, right? 1. Number 2, the number of target children who attending the clinic for any reason. The second one, because of that, from those prompts, maybe because each participant, the idea was that each participant should, or each family should receive any one of them, right? The second thing that the researchers wanted to figure out was the number of target children attending the clinic for any reason. And the third one is the total number of immunizations received by the target children. So the first one, the number of target children receiving 1 or more immunizations, 1. Number 2, the number of target children attending the clinic for any reason. Number 3, the total number of immunizations received by target children. Now, I hope you know the experimental groups, you know the control groups, you know the IVs, and now you know the DVs as well. DVs, the dependent variable was measured through 3 different ways, and this is what the researchers were looking for. Taking this ahead, when all was the data collected? The data was collected 2 weeks right after the mail was sent once. Yeah, the first time. The second time after 2 months of the mail being sent, and the third time after 3 months of the mail being sent. I'll say it again. The immediate effect of all conditions was measured after 2 weeks. That is the first time. The time during which the monetary incentive and the increased clinic access was relevant. And there were two more follow-up measures, right? Now, these two follow-up measures that we're talking about, the first follow-up measure was after 2 months, and the third one was after 3 months, right? So 2 weeks, 2 months, 3 months. Learn it. Learn it. Know that you can be questioned on anything, like literally anything. Now, taking this ahead, checks were put in place. We're talking about checks being put in place. We're talking about how the researchers, that is Yokley and Glenwick, they were trying to the best of their capacity that the internal validity of the research is high. Checks were put in place to ensure the accuracy of the specific prompts that were written. Now, you're sending specific prompts. You need to be sure, you need to double check if the prompts were written the way they should be written, if they're being sent with the correct names and as well as the correct addresses and the correct immunizations that were to be given at the clinic. A random sample of 10% of specific prompts were checked and 93% were found to be completely accurate, which is pretty high. For the sample of name and mailing addresses, there was 100% accuracy and reliability of immunizations given by the clinical staff. So these are measures that add on to credibility, that add on to the internal validity of your research. Quickly moving on to the results. Remember, there were three things that were being measured: the number of children being immunized, the frequency of children attending the clinic, and number three, the total immunizations that were given. Now, if you have a look at the results showed that there were significant differences between different groups, right? There were six different groups that we had spoken about, the first four being the experimental group, and the latter two being the control group. Sorry. As expected, the monetary incentive group had the biggest impact, as predicted, as expected, as hypothesized by the researchers, that the monetary incentive group had the biggest impact. One, followed in descending order by the increased access group, specific prompt group, general prompt group, and control groups. These findings remained significant at both the 2-month and the 3-month follow-ups, as shown in figure 8.8 that I'll just show you right now. The specific prompt and monetary incentive method produced a 29% increase in the number of immunizations given, and that's a significant difference. Now, I don't know if you'll be able to understand this, but if we need to understand this part to be able to understand the one above. So this is general prompt. For the general prompt, if you try tracing, this is how it goes. Here you go. So this is the general prompt, okay? If I talk about the pooled control groups, so if you talk about the control groups, let's pick up this color. See, this is the one that goes the lowest, right? If we talk about specific prompts with monetary incentive, let's pick up the color green. Specific prompts with monetary incentive. Look at how amazingly this has worked. So incentive, money was an incentive here, right? Where there was specific prompt and an increased access. I want to take this color or maybe purple. This one. Specific prompt with, here you go, right? So this is pool control group. The green one is a specific prompt with monetary incentive. And now I'm left with the specific prompt without increased access, without monetary incentive. And what color am I left with? Let's pick a blue. Yeah. So see the results, they're quite evident. This shows how so what is this? This says cumulative percentage of target children receiving one or more inoculations. This is after 2 weeks, that is the intervention period. Then comes the first follow period, that is after 2 months. And this is the second follow period, right? Even if you're not understanding a lot, just see green is at the top, followed by purple, right? Now, taking this ahead, as well as researchers measuring the effectiveness of each method, the researchers also wanted to find out which was the most cost-effective method. Remember, the third and the fourth group, the third and the fourth experimental group, they cost you money. In the fourth group, there were $175 that you were offering as an incentive. Even for the third group, that is an increased access group, you're offering to have your clinic operational for extra hours. Extra hours means extra cost that has to be incurred in terms of light, in terms of the I mean, there'd be many resources that they'd be used. Your staff would have to stay for longer. More so, you're offering a full day care for a day, where you're offering parents to send over their kids, and you'd feed them, you'd entertain them, and the parents could go about spending their day the way they want to. So all of this is going to cost you money, right? Now, taking this ahead, results showed that the specific prompt was the most cost effective intervention, with the specific prompt and monetary incentive being the least cost effective in the longer run. Of course, because you were offering money, $175. The increased access was considered to be the least cost effective initially, but as the impact continued at both the follow ups, it became slightly more cost effective in the longer run than the monetary incentive. However, when considering the extent of the impact of each intervention immediately and at both follow ups, the specific prompt and monetary incentive was found to be the most cost effective. So, after the follow ups, the specific prompt and the monetary incentive was found to be the most cost effective, significant intervention in the longer run. So, if we talk about the application of psychology being used, or if we talk about the usefulness of psychology here, these results have implications for national departments of health and other healthcare providers in terms of having a better understanding of how best to use community intervention programs effectively. Having a quick look at the evaluation of this study, yes, this was a large scale study. This targeted a huge population, so the amount of data that was collected was large as well. The data was representative of the entire target population, and this, of course, adds on to the population validity of this research. This research could also be seen as a longitudinal research, as there was the immediate 2 week measure as well as two follow-up measures, that is after 2 months and 3 months. This increases the validity of the research as it shows the long-term impact of each intervention rather than just the immediate benefits. The researchers' use of checks to make sure the accuracy of the specific prompts, the mailing addresses, and the provision of correct immunizations, they all were important controls. And the higher your controls are, the more accurate your findings would be. The more accurate your findings would be, the more valid your research can be considered. And this, of course, adds on to the reliability of the research as well. So this ensures the validity and reliability of the study, as we can be confident in the accuracy and the consistency of the findings. Taking this ahead, the research by Yokley and Glenwick has great importance in terms of application to everyday life, as the implications could influence approaches used by departments of health and other healthcare providers. This is an effective understanding that general prompts are not very effective, but that specific prompts, with or without money incentives, are significantly more effective, could make a huge difference in immunization uptake, right? So what you do is, as a healthcare provider, or if you talk about the Department of Health, they'd like to have a look at the pros and cons. They'd want to weigh down the goods and the bads, right? So cost, of course, in the long run does matter. And understanding that general prompts are not very effective, but the specific prompts with or without monetary incentives are significantly more effective, could make a huge difference in immunization uptake, as well as a range of other important health related campaigns. The use of monetary incentives may not be appropriate in all cases. However, it could be used in an isolated case where a particular immune deficient population needs to be targeted. So you can't be doing this at a national level. You can't be offering money to everyone in your entire country. But nonetheless, if the government, if the state sees that there's a particular area which is immunization deficient, the government can offer money and get things done the way they want them to get done, and of course, for with all the good intentions. So needs to be targeted as a relatively quick, easy, and cost-effective way of increasing numbers of immunization. So like I said, this was the key study. I hope you all know that you need to know everything about a key study. There are 5 different key studies in health psychology, and there are 5 in clinical psychology as well. So every unit, that is every chapter, has a key study. You need to know that key study really well. So yeah, this is pretty much it for the day. I hope this has been helpful. Thank you.